Good afternoon, everyone, once again. Posterior scleritis is an uncommon scleral inflammation. It has a various manifestation and it is an unknown entity, so it is often misdiagnosed, but when treated, it has an excellent response to anti-inflammatory medication. So in our study, the aim of a study is to study the clinical profile and imaging characteristic of posterior scleritis in a tertiary eye institute. For this, a retrospective analysis of 37 eyes of 27 patients were done between January 2013 to December 2020, with the mean age of follow-up of 23 months that ranged from 1 to 120 months. In our study, mean age was 46.47 years, with the range of 15 to 70 years. We can see when we saw the distribution of according to the age and sex, female preponderance was seen, and it was noted that below the age of 40 years, only female patients were included. So overall ratio of female was 74%, and unilateral case was 76% in our study. Large number of patients, that is 56.1% of patients, there was no associated systemic disease, followed by rheumatoid arthritis in 9.75% of cases, tuberculosis, SLE, and other such association. Anterior segment manifestation, 14 patients had no anterior segment manifestation, followed by conjunctival hyperemia, aqueous cells and flares, cataract, raised IOP, proptosis, and shallow AC. In posterior segment, subretinal fluid and choroidal folds was the most common manifestation, followed by disc edema. Investigation were done. Raised ESR was most commonly seen in 51.85% of patients, followed by rheumatoid factor positivity that was seen in 11% patients, ANA positivity, Montague's test, C-ANCA, double-stranded DNA, CRP, and anti-CCP body came out positive in some of the patients. USG B-scan was done. Choroidal thickness, increase in the choroidal thickness was noted in 100% of patients. T sign was noted only in 43% of patients. Exudative RD, scleral thickening, and choroidal detachment was seen as follows. Fundus fluorescent angiography revealed macular edema and pooling of the dye in 37.83% of patients. Disc leakage and pinpoint hyperfluorescence was seen in 21.62% of patients. 33% of patients were treated with systemic steroid, and NSAID was added in 26% of patients. 41% patients were shifted on immunosuppressive agents. So the outcome of our study was a complete resolution that was seen in 20% of patients. Retinal epithelial defects were seen in 20% cases, and scarring was seen in 18% cases. So the average age in the largest series of posterior scleritis was 49.3 years. In our study, it was 46.67 years. Female preponderance was seen in almost all the studies. Idiopathic posterior scleritis in previous recorded series was 68.68%. In our study, it was 56.1%. So to conclude, ultrasonographic abnormality include increased thickness of the ocular coats, T sign, and retinal detachment, subretinal fluid. Fluorescein angiography may add useful additional information in selected patient. Non-steroidal agent, oral steroids, periocular steroids have been used successfully in the management of posterior scleritis. Complete resolution of inflammation often takes several weeks. Patient with loss of vision, evidence of optic nerve involvement, and systemic disease need aggressive immunosuppressive therapy. These are my references. Thank you.